wide and diverse population. Socioeconomically, ethnically, everything you can think of. Prince George's County probably has the best mix of Americans that you can find in this country. But with that challenge of being ethnically diverse and economically diverse and educationally diverse comes that challenge in how do we deal with the healthcare problems in the county. Our location in the National Capital Region also provides some interesting issues. But Prince George's County in and of itself is a healthy county. It's a very prosperous county, but it's a county that is in need of a few very basic things as far as healthcare is concerned. We need physicians. We need a workforce that will be able to provide healthcare for our citizens. Prince George's County lags far behind some of our neighboring counties and cities with the number of primary care physicians. Prince George's County needs the safety net in order to catch those individuals that are uninsured. We have 5 centers that are attached to a federally qualified health center, and those 5 centers would have to each care for 30,000 residents of our 150,000 uninsured. And if you include the other 100,000 of individuals who are underinsured, then you increase the burden on those 5 few centers. Baltimore City and Washington, D.C., 2 cities that are in close proximity to us with similar demographics, have 40 and 44 safety net clinics, each having to see maybe 1,500 to 2,000, 2,500 individuals per clinic. So there are opportunities for access in those places that Prince George's County just simply does not have. But the issue in Prince George's County is that if you have a person that does have insurance and does have an income above $50,000 a year, then unfortunately for Prince George's County, sometimes your health outcomes are no different from someone that has a lower socioeconomic status. So just the fact of having health insurance and having access to insurance in this county and in many other places around the country, not just here, does not equate to equality in health care. Doesn't equate to it. So we think of a term called health disparities. Health disparities mean if you take 2 people, everything else equal except for their race, then their outcomes are different. And we deal with that issue in Prince George's County. But as I thought about this evening, and in the few minutes I have, I thought about how could I explain and understand this difficult issue of delivery of care and what is required to help someone to be healthy. And I actually thought about buying a pair of shoes versus buying a suit, a men's suit. I don't know about buying women's suits, but I can tell you about buying a men's suit. And I thought about it, and I said, well, if you go to the store and you want to buy a pair of shoes, you look on the shelf, you see the shoes you like, you try on a couple of pair of shoes, you walk around in the store, and I am sure that in the shoe store they have special carpet to make the shoes feel good when you're in the store. It's got to be some special carpet because you walk around and say, these shoes feel pretty good. Then you go home and you walk out in the asphalt and you're going, oh my goodness. My feet are hurting. You can do nothing with those shoes but sit them on the shelf or give them away. Spend your money for them, nothing you can do. You go buy a suit, though. Most of us, like myself, I buy suits off the rack. I haven't been in a position to get tailor-made suits. Don't know if that's going to happen in this lifetime. You go buy a suit. You take a suit off the rack. What happens when a man takes a suit off the rack? You try on the suit. Someone walks up to you and says, let's see how that fits on you. How's your waist? How's your inseam? Is that the right length for you? Do you want a straight leg or do you want a cuff? Do we have to take in your jacket a little bit? And you're able to take that suit and have that suit altered just a little bit so that it fits you. And as I think about healthcare in this country, most of the healthcare that we receive is like buying a pair of shoes. There's not much that you can do to get that shoe to fit your foot. There's not many alterations you can make in a pair of shoes. Now, I've seen people cut the toe out on their shoe. I've seen people cut the back out so all of a sudden they made a pair of slippers. But if the shoe wasn't made a slipper and you cut it to make it look like slippers, don't wear it in public. Wear it at home. If you cut the toe out because it hurts your big toe, just wear it in your backyard. Don't come out. If you have to, you do what you got to do. But when we think about healthcare, if you have a choice to have a HMO or a PPO, or if you have some Medicaid or Medicare, there's not much tweaking that you can do in our system. You take what you got and you use what you have. And for many of us, for many individuals that have health insurance, using what you got is not enough, because it is not an effective way to deliver care to the specific needs of the individual. And for healthcare, healthcare is such a special event that occurs. To go into an examination room, to take off your clothes, to put yourself in positions that you would never want anybody else to see you in, is a very special experience. But not to have the ability to have someone tailor that to you so that it meets your needs, is delivered at the time when you'd like it to be delivered by a person that you would prefer, who you think wants to even see you when you're there. For a person who has time to take care of you and listen to you, because I might not be a 10-minute or 15-minute person. If you want to put your finger in places that I don't really like people to put things, it might take you more than 15 minutes to talk to me to find out it's okay to check me out. I just sound strange. Maybe it takes me a half an hour. How you doing? Well, I don't know. Let's just talk for a little while, because I got to relax. I mean, I'm not, I'm just, how's it going? Let's just sit down and have a conversation. I mean, you want me to do what? I mean, and many people just go, you know what? No, thank you. And there are many people that may have access to insurance that just say, no, thank you, because you don't have time for me, you won't listen to me, and you don't represent or speak to me in the manner I want to be spoken to. So therefore, they do not get health care. So I profess that health care has to be delivered in a manner that can be, as much as possible, tailored to the needs of the population that is being served. Because otherwise, health disparities will continue. Individuals will choose not to access the system, even when they do have insurance, and still have worse and poorer outcomes. Health education will not be effective. It's not delivered to individuals in a manner in which they are appreciative of. The Prince George's County Health Department is in the business of serving the people of Prince George's County. Quite simply, in the business of serving the needs of our citizens with the programs that we have. But we have the luxury of practicing medicine and delivering health care with the primary focus only on the individual. You give me $1, we spend $1 on delivering care. So in public health, we have that luxury of saying, you know what? The most important thing to me is that you understand what I'm telling you and that you are able to receive the care that I can offer you. It may take 5 minutes, it may take 10 minutes, it may take an hour. But we try to tailor our services to meet the needs of the individual. Medicine has to reach the point when we are not forcing people to swallow something that they do not want to swallow. We have to give individuals the opportunity to receive care in a manner that's respectful to them, that provides the information in a manner that they can receive, and gives them the opportunity to ask questions. And so as a practicing physician for many years, I understand the business of medicine. And I don't have the answers for how to pay for it, and that's not my job to figure out how to pay for it. I think about it a great deal. But I try to make sure, and I'll share one thing I've said before in other places, that I left private practice because my wife told me, and I've mentioned it at a meeting just recently, I couldn't practice medicine as a business. I had a problem. I had a problem with providing care for someone and then billing them for it or sending them to collections because they couldn't pay for it. So I tell my business office, I say, don't worry about it. And they say, well, you did that with the last person. I say, I know, but, well, another person. I say, well, don't worry about it. Just forget about it. So then, after working in another place to support my private practice for many years, I just had to say, you know what, I'm going into public health. So I can just focus on delivery of the care and not on the income part of it. But I know medicine's a business, and I'm not saying anything bad about the business of medicine. But I do want to say that understanding that we, as a people, cannot accept one size fits all in healthcare, and that Prince George's County has to have options for the entire spectrum of our community. Some care may need to be delivered in public health clinics that are in settings that a person comes in and feels welcome. Some people don't want to go into an ivory tower or a big place where people around don't look